The TOPFIX system is used to adjust the O-shaped deformity of the knee caused by abnormal knee joint deformities caused by various causes such as degenerative arthritis. The plate is divided into left and right depending on the direction, and the cross-section is designed at a 10-degree angle to match the anatomical shape of the tibia bone. Locking screws can be applied to all holes, and the head screw part has an angle of 10 degrees and an angle of 5 degrees based on the left side of the interior direction, providing stable insertion into the bone and solid fixing force. The TOPFIX wedge is designed to allow the user to perform the procedure at their desired location by applying a plate shape. The TOPFIX system consists of 4 parts: TOPFIX, wedge plate, low-profile screw, and locking screw. To prepare for surgery, the patient is placed in supine position on a radiolucent operating table. If the leg is fixed, there are 2 approaches to accessing the surgical site by making an incision in the skin. The first approach is performed with the knee flexed at 90 degrees. Key anatomical landmarks such as the medial joint line and the tibial tuberosity are marked on the skin. Access to the upper medial tibia is achieved through a transverse skin incision of approximately 5 centimeters. The critical aspect of this step is exposing the posterior medial corner of the tibia. In approach B, a longitudinal incision of approximately 5 centimeters in length is made anterior to the posterior medial crest of the tibia. The superior aspect of the pes anzurine is incised and lifted to visualize the anterior border of the medial collateral ligament, allowing access to the posterior medial corner of the tibia. When the distal end of the PCS retractor reaches the head of the fibula, the PCS cutting guide is inserted through the anterior portion of the PCS retractor. Posterior to the proximal tibia, the tip of the PCS cutting guide engages the posterolateral cortex of the proximal tibia to protect the lateral cortex. The tip of the cutting guide should be positioned between the tip of the fibula and the fossa to prevent unnecessary osteotomy. In the next step, check the angle of the cutting surface through the side C-arm image. Adjust the slope of the cutting block by manipulating the protector handle and insert the guide pin when the cutting slope is judged to be appropriate. The guide pin prevents the saw from moving forward in unexpected directions and secures the cutting block to the inner cortex. Perform sawing work while adjusting the saw mass according to the type of cut. Stop sawing when you feel metal touching the end of the protector during cutting. After removing the PCS cutting guide, a final inspection is performed using C-arm imaging, and additional osteotomy or distraction surgery can be performed if necessary. An osteotome is inserted to widen the incisal gap while maintaining the lateral hinge. The insertion length is equal to the cutting depth. The osteotome is sequentially inserted and expanded until the cut gap is opened to the desired extent. After reaching the desired degree of correction, leave the osteotome as is and insert a spreader into the cut surface of another part to maintain the correction height. Using a spreader, confirm the gap width and determine the size of the wedge to be inserted into the cut surface. Then, use a guide and drill bit to drill. Once drilling is complete, select an appropriate length screw and tighten it. After attaching the proximal drilling block to the plate, secure the plate to the tibia using guide pins. Use a hand guide and drill bit to drill through the DCP hole in the plate. Measure the depth using a depth gauge, then tighten a cortical screw of appropriate length to secure the plate. Drill using a hand guide with a 4.3 mm diameter drill bit. After removing the hand guide, verify the depth to determine the length of the proximal locking screw. The screw should be chosen as long as possible without protruding from the lateral cortex. When inserting the screw, avoid tightening it completely. Instead, manually tighten it using a torque limiter in the final step. Drill the 2 holes at the bottom of the plate using a hand guide. As with the top hole, measure the depth with a depth gauge, then select a screw of the appropriate length and tighten it. Finally, the procedure is completed by manually tightening the screw using a torque limiter.